All right, so we're now discussing adverse events or side effects. So, adverse drug reaction overview. So, adverse events information with escitalopram was collected from 715 patients with major depressive disorder who were exposed to escitalopram, and from 592 patients who were exposed to placebo in a double-blind placebo-controlled trial. During clinical trials, all treatment groups were comparable with respect to gender, age, and race. The mean age of patients was 41 years old. The range was 18 to 76. Of these patients, approximately 66% were female and 34% were male. The adverse event information for escitalopram in patients with obsessive compulsive disorder was collected from 2 studies with double-blind placebo-controlled treatment over the period of 24 weeks. In the first study, a total of 227 patients were exposed to escitalopram and 114 to placebo in a 24-week double-blind placebo-controlled fixed-dose trial with assessment at 12 and 24 weeks. So right here, they're just explaining how the trials were conducted for OCD and for major depression, but we're not actually into the side effects yet. Okay, so adverse events observed in control trials. So adverse events associated with the discontinuation of treatment. So from a short-term, 8-week placebo-controlled phase 3 studies in patients suffering from major depressive disorder, the incidence of discontinuation was 17.3%. So 124 of 715 patients discontinued the medication. Discontinuation due to adverse events was more common in the active treatment group. So 5.9% escitalopram and 5.4% in the citalopram group, and only 2.2% in the placebo group. So more people stopped taking the medication than the placebo due to side effects, which is to be expected. The events that were associated with discontinuation of escitalopram in 1% or more of patients at a rate of at least twice of that of placebo. So these are the main things that were causing people to discontinue taking escitalopram. So nausea is 1.5 versus 0.2%, and ejaculation failure. During the first 12 weeks of treatment, in the 24-week placebo-controlled trial, discontinuation of treatment due to adverse events was reported for 9% and 11% of the 227 OCD patients who were treated with 10 milligrams per day or 20 milligrams per day of escitalopram, respectively, compared to 5% of the 114 patients receiving placebo. So all patients who discontinued treatment due to adverse events in the escitalopram group did so in the first 12 weeks. 8% of patients receiving placebo discontinued treatment due to adverse events in the 24-week total period. Adverse events that were associated with discontinuation of at least 1% of patients treated with escitalopram, for which the rate was higher than placebo, were nausea, insomnia, and erectile dysfunction. So far for the 2 studies, for the major depressive disorder study and the obsessive compulsive disorder study, the main reasons people stopped taking the medication were nausea, ejaculation failure, erectile dysfunction, insomnia, and nausea. Most frequent adverse events. So adverse events that occurred in the escitalopram treated patients in the course of the short-term placebo-controlled trials with an incidence greater or equal to 10% were headache and nausea. The incidence of headache was higher in the placebo group, which suggests that this is a non-specific symptom related to underlying condition or treatment administration. The point prevalence of nausea increased during the first week and then decreased to approach placebo levels at the end of the studies. Okay, so now we have a table with all the listed side effects. And again, these are from these studies that we discussed above. And it shows the percentage of patients that experience these side effects on escitalopram compared to on placebo. Let's just go through this chart here and look at we'll forget about placebo, but we'll just look at the percentages of the group that were taking the medication. So heart palpitations, 1.4%, vertigo, 1.4%. Now with gastrointestinal disorders, so nausea, 15.2%, diarrhea, 8.4%, dry mouth, 6.6%, constipation, 3.5%, dyspepsia or upset stomach, 3.1%. Then we have abnormal pain in the abnormal upper abdominal pain and stomach discomfort around 1.1, 1.5. So continuing to move down, we have fatigue, about 5%, pyrexia, about 1%. Now infections and infestations, so nasopharyngitis, under 5%, influenza, 4.3%, sinusitis, 2%, gastroenteritis and herpes simplex, both under 2%. An increase in weight was 1.8, very close to placebo, so hard to really justify that. Decreased appetite, 2.4%. Increased appetite, 1.7%. Arthralgia or joint pain, 1.4%. Pain in the extremity, 1.4%. Dizziness, 6.3%. Somnolence, 4.1%. Sedation, 2.4%. Migraine, 1.5%. We have tremors, 1.5%. Lethargy and sinus headaches, both 1%. Insomnia, 8.2%. That's significant. Anxiety, 2.2%. Decreased libido, 2.1%, which is much higher than placebo. Inability to have an orgasm, 1.8%. Again, much higher than placebo. Abnormal dreams, 1.3%. Hyperhidrosis, so sweating, 3.4%. Night sweats, 1.7%. Rash, 1%. Hot flush, 2.2%. So reproduction system and breast disorder, so sexual side effects, ejaculation delayed, 3.6%. Notice here, placebo, we're all 0%, so these are significant. Ejaculation failure, 2.7%. Erectile dysfunction, 2.7%. Ejaculation disorder, 1.3%. The following events had a higher incidence in the placebo group compared to the Escitalopram group: vomiting, abdominal pain, flatulence, upper respiratory tract infections, bronchitis, back pain, neck pain, and headache. Adverse reactions observed with Escitalopram are in general mild and transient. I'll say that again. Adverse events observed with Escitalopram are in general mild and transient. They are most frequent during the first and or second week of treatment and usually decrease in intensity and frequency with continued treatment and do not generally lead to a cessation of therapy. So typically your body gets used to the medication and the side effects do go away. In a clinical trial involving patients with major depressive disorder that compared fixed doses of Escitalopram, 10 or 20 milligrams a day, with placebo, the most common adverse events that occurred in patients treated with Escitalopram are shown in Table 2. So the most common adverse events that occurred in patients treated with Escitalopram are shown here. So diarrhea, 10% for 10 milligrams a day, 14% for 20 milligrams a day. Nausea, 22% for 10 milligrams a day, 13.6% for 20 milligrams a day. Insomnia, about 11% for each. Dry mouth, 11% and about 10%. Dizziness, about 10%. Ejaculation failure, so nobody taking 10 milligrams a day had ejaculation failure, but 7.3% taking 20 milligrams did. Nasopharyngitis, 5% on 10, 7% on 20. Constipation, 2.5% on 10, 5.6% on 20. Dyspepsia, 6% on 10, 4% on 20. And Pharyngolaryngeal pain, 6% on 10, 1.6% on 20. Male and female sexual dysfunction with SSRIs. While sexual dysfunction is often part of depression and other psychiatric disorders, there is increasing evidence that treatment with selective serotonin reuptake inhibitors, SSRIs, may induce sexual side effects. This is a difficult area to study because patients may not spontaneously report symptoms of this nature, and therefore, it is thought that sexual side effects with SSRIs may be underestimated. So table 3 here shows the major sexual side effects. So decreased libido, 2%. Inability to have an orgasm, 1.8%. Now males only, ejaculation delayed, 3.6%. Ejaculation failure, 2.7%. Erectile dysfunction, 2.7%. And ejaculation disorder, 1.3%. They also have tables here going through the studies for the obsessive compulsive disorder trial. We just went through the side effects for the major depressive trial. I don't think there's much use in going through the tables for both. So if you would like to go through these numbers, pause the video now, take a look at the numbers. Again, obsessive compulsive disorder. Pause the video now, take a look at the numbers. This should be similar to that of the major depressive disorder group. Adverse reactions during treatment for up to 44 weeks. The treatment emergent adverse event incidence profile of escitalopram is a longer-term study in patients with major depressive disorder consisting of a 36-week placebo-controlled relapse observation phase in responders of a preceding 8-week acute treatment phase was similar to that observed in short-term studies. So even when the medication is used for longer term, the percentages of side effects still seem to be the same in those shorter trials.